All right, I think we can get started as more people continue to trickle in. Hello, everyone, and welcome. Thank you so much for taking the time out of your day to join us today for this webinar on substance abuse, addiction, and recovery in the American Muslim community. My name is Sajila Munir, and I'm the Outreach and Partnerships Manager at the Institute for Social Policy and Understanding, or ISPU. If you're comfortable doing so, please feel free to introduce yourself in the chat and where you're joining us from and what your sort of interest in this topic is. This webinar is based on a newly released report conducted by ISPU in partnership with Stanford's Muslim Mental Health and Islamic Psychology Lab. This webinar will explore issues of substance use, and addiction in American Muslim communities through a variety of lenses. So we'll be looking at community and stigma lens, the culturally responsive care lens, in the family and faith lenses. So we will highlight findings from the report and discuss actionable steps for community members, for faith leaders, clinicians, and policymakers to reduce stigma and to strengthen compassionate and inclusive pathways to recovery. I also encourage you to share in the chat any resources related to these issues that you might be familiar with. We'll be sharing sort of a larger list of resources at the in our follow-up email following the webinar. So to start us off, I wanted to give you all a little bit of background about ISPU for those of you that may not be familiar with us. And if you are familiar with us, then it's just a little refresher. So ISPU is a nonpartisan nonprofit organization that builds understanding and strengthens communities by laying a foundation of facts. As the only organization of our kind, we're the go-to source for anyone that's seeking information about Muslims in America and the issues that impact them. So at ISPU, we envision an America where Muslims are thriving and equal, and our mission is to provide objective research and education about American Muslims to support well-informed dialogue and decision-making. A little bit about our history. We were founded in 2002. We were originally founded in Michigan and focused on international issues. And now we are very much nationwide and focus on domestic issues. We have 12 staff members that are located all across the country. A little bit about our research. So ISPU is a research organization that's very committed to rigorous data-driven and solution-seeking research. Our goal isn't just to sort of describe the challenges that face American Muslims, but to generate sort of evidence that communities, practitioners, and policymakers can actually use. Our work is grounded in the lived experiences of Muslim communities. We focus on research that reflects real realities, often under-researched or misunderstood, and centers voices that are often left out of policy and public conversations. ISPU is deeply connected to the academic institutions as well as national and local partners. That means our research sits at sort of the intersection of scholarship, community knowledge, and sort of more real-world application. Our research spans 4 core focus areas. So we have family and wellness, where we examine sort of mental health, caregiving, substance use, and overall well-being. We have community capacity building, which looks at how institutions like mosques and community organizations can better support their members. We have American pluralism, where we study belonging, discrimination, and the health of our democratic society. And then lastly, we have American Muslim contributions, which highlight the civic, cultural, and social contributions of Muslims across the country. So this report on substance use and recovery sits sort of at the intersection of several of these areas, particularly family and wellness and community capacity building. So here's just a short sampling of some of our more recent reports, including a report on access to healthcare among Arab American South Asian Muslims in Southeast Michigan, our latest American Muslim poll 2025, our report on the effects of Muslim portrayal in entertainment media on attitudes and on attitudes toward democracy and policy, and then lots of others. I encourage you to visit our website after this webinar and explore some of these reports further. So shifting to this study specifically, just some background on our research team. Our primary investigator for this report was Dr. Rania Awad, who is joining us today as a panelist, and I'll be introducing her in more detail uh, as I introduce the rest of the panelists later on. The research assistants for this report were Dr. Amina McBride-Redzovic, who will be taking us through some of the report findings today. Amar Kazi, Jenna Shagan, Haba Khan, Sana Sharif, and Taimur Khoser. So a little bit about our advisors for this project. We had Basim Hamid, who's the president of the Wasat Institute, Amer Rahimullah, who's the associate clinical professor of psychiatry and behavioral sciences at Stanford University, Ali Syed, who's the founder and CEO of Hype Athletics, Community and Safe Psychology and Wellness Center, Abdurrahman Warsami, who is the co-founder and executive director of Generation Hope, and Sabari Zahir is the founding director of Lamps of Light Project, lead addiction counselor at Lamps of Light, and chaplain at University of California, Los Angeles. Tabari will also be joining us as a panelist today. All right, so I'm going to stop there. And I'd like to introduce you all to Dr. Amina, who will be taking us through some of the report findings. So Dr. Amina is a mixed method community health sciences researcher whose work sits at the intersection of mental health, race, religion, and stigma. She completed her PhD at the University of Illinois, Chicago, where she wrote her dissertation, The Impact of Singleism on Mental Well-Being for Unmarried Muslim American Women, explored how stigma and social pressures surrounding singlehood affect mental health outcomes among Muslim Americans. Dr. McBride-Redzovic currently serves as the lab coordinator for the Stanford Muslim Mental Health and Islamic Psychology Lab, where she oversees 9 research branches and a team of over 60 mentees, team leads, and faculty affiliates. Her full bio will also be in the chat, so over to you, Amina.
Thank you so much. Can you all see my screen okay?
Yes.
Okay. So thank you, Sajila, and thank you to the ISPU for the opportunity to share these findings. I'm really grateful for being a part of this conversation, alhamdulillah. I'll begin by situating our study within the broader national context before moving into the findings that we have for you today. So we know substance use disorder remains a significant and escalating public health issue in the United States. Over the past decade, we've seen substance use and overdose mortality increase substantially, and particularly in the number of individuals meeting criteria for substance use disorder, especially adolescents. And importantly, substance use disorder doesn't exist in isolation. It intersects with other mental health conditions, incarceration, unemployment, and other broad structural inequalities. And experiences with and consequences of substance use disorder and substance use in general differ by gender, race, ethnicity, age, and other sociodemographic characteristics. And so, marginalized communities often do not have higher rates of use, but they experience significantly harsher consequences, including disparities in criminal charges and legal system consequences, along with limited access to treatment. And so when we look at the American Muslim context, we see that the American Muslim community is the most ethnically diverse religious group in the United States, with the majority of the community identifying as non-white. That demographic reality is important because, as I just mentioned, while marginalized communities don't necessarily demonstrate overall higher rates of use, they frequently experience more severe legal, medical, and systemic consequences. And so when we examine substance use and addiction in the Muslim community, we have to understand it within both a religious and a racialized context. So, existing estimates support lower reported rates of substance use among American Muslims compared to the general population. However, existing research and clinical experience strongly suggests that there is an underreporting that is happening that is likely substantial, largely due to stigma and fear of disclosure around use and addiction. So that tension between the reported rates and the lived realities within the community is part of what motivated this study. So rather than focusing on prevalence or numbers or statistics, we chose to focus on lived experiences of people who've navigated this reality. Our objective was to better understand how substance use and addiction experiences were experienced within the Muslim community. And specifically, we sought to understand and explore the motivations for use, the barriers to care, the community responses to substance use and addiction, and the resources that individuals found helpful or that they found to be lacking. We also examined Yeah. We also examined the perceived perception of substance use in the community as understood or experienced by participants. And finally, we highlighted three frontline organizations that serve Muslim community members struggling with substance use and addiction, and the work that they do to address this challenge. So methodologically, we conducted 14 in-depth semi-structured interviews with individuals either in recovery or family members who had loved ones who either were currently struggling with addiction or had been in who were in recovery, along with the service providers that I mentioned earlier. The interviews were approximately 1 hour in length and analyzed using a thematic analysis approach. Three researchers from the team that was mentioned earlier independently coded the transcripts and then engaged collectively in an iterative process to identify the themes. And so with many qualitative studies involving stigmatized experiences and marginalized populations, recruitment was extremely challenging for the study. I'll talk a little bit more about that later on. But the stigma around substance use and the stigma around mental health that still exists within the Muslim community really limited participation. And so with this context, I'll turn to the central themes that we identified, and we'll go through kind of what those were. So one of the first things that was identified among participants was how they conceptualized addiction, how they understood it, how they defined it. Addiction was consistently described not as a moral failure, but as a progressive illness characterized by loss of control and dependency on the substance or behavior. Participants frequently differentiated between initial recreational use and the gradual development of a compulsive use of the substances that they or their family members partook in. Importantly, many understood addiction as layered and talked about how they engaged in substance use as a way of masking trauma or to address untreated mental health conditions or chronic stress that they had been experiencing. Okay. Oops, that went too fast. Sorry. Okay. So motivations for use were rarely described as impulsive or purely recreational, that people were just doing it for fun or they were just doing it because their friends were doing it. Often trauma, familial instability, early exposure to substance use among other family members or friends, peer influence to try a substance use, and bullying, and social isolation were recurring themes among all of the participants for why they or their family members started to engage with substances. For many, substance use functioned, as I mentioned, as a coping mechanism and an attempt to regulate emotional pain that they had experienced either earlier in life or that they were currently experiencing. So this pattern of trauma and familial instability, peer influences, and social isolations were remarkably consistent across the interviews. And we'll see a couple of illustrative quotes that we'll go through here today. So this person was a man. He was 59 and he was talking about his own personal recovery journey. And he shared that at the age of 14, his community experienced a significant trauma in which a friend, classmate, had committed suicide. And because of that shock to the community, it really impacted him in a negative way. And that sort of opened the door for him to start engaging with substances. Which then turned into a recurring substance use disorder. One female participant shared that her brother was struggling with addiction, her sister struggled with addiction, her mom struggled with addiction, and so all the people around her were struggling with addiction in some way or form, and that sort of facilitated her experiences with substance use and addiction as well. Um, some of the participants talked about family members who went undiagnosed, but as they went through and navigated their own personal journey, they were able to identify that this was an undiagnosed addiction or substance use challenge. Um, and so because it was present within their early childhood experiences, that sort of opened the door for them to also experience substance use and navigate that challenge. And then finally, peer influence was a big a recurring theme among several of the participants, where friends and classmates would introduce them to substances, um, and they would engage in initial substance use. Often, this peer influence was overlapped with other traumas, mental health concerns. So it wasn't that each of these individual themes or experiences were sort of working in isolation, but oftentimes participants were layering these different experiences together to paint a broad picture or a richer picture of what led up to them experiencing substance use and addiction. Again, a lot of stress and trauma that people shared. Many of these participants were older and had significant traumas. Some folks talked about experiences that were that led to PTSD type symptoms, um, and all of these in combination sort of facilitated substance use, which then led to addiction. So the third theme was around family, and family emerged as both a protective and a complicating factor. Many participants described unwavering familial support. Families provided emotional encouragement, resource seeking, and took efforts to support finding both religious and treatment-based interventions. At the same time, some families relied exclusively on spiritual remedies without integrating clinical support, or they unintentionally engaged in enabling behavior by providing financial support or continuing to allow harmful behavior in their homes with children, things like that. Participants emphasized that education and clear boundary setting within families were critical components to their journeys and to their recovery process. And some of the participants identified that this was only something that they were able to understand and to sort of conceptualize looking back on their experience and their journey several years into their recovery. And so one participant shared that their family never gave up on them. They always had faith. They always continued to keep trying, which was huge because their hope and their faith eventually helped this participant gain his own hope and his own faith as he navigated through this journey. His mom in particular would do a ton of research and recommend things. And she connected him with different masajids and Muslim Alcoholics Anonymous groups. On the other hand, a female participant talking about a family member who was in recovery shared that this family member had probably been an addict for several years. They had convinced themselves that prayer alone could solve this, and never looked into therapy, never looked into psychiatric help or rehab. And this participant wished that Muslims were more open to mental health assistance. In this conversation, she also talked about how the family surrounding this individual took a very similar approach. So it was something that was a sort of family norm for them. Now, the fourth theme talked about resources that participants used and resources that participants wished that they could have engaged in. Participants described engaging fairly conventional treatment pathways. Rehab centers served as structured environments for detox, counseling, and relapse prevention, with some participants stating that inpatient programs were the most effective for them. Therapy was described not only as being used to address active substance use or addiction, but it extended beyond to address trauma, grief, or other co-occurring mental health conditions as well. As I mentioned earlier, for most of the participants, there was an overlapping conversation about these different elements of mental health challenges that they were experiencing that intersected with their substance use or addiction. Participants also mentioned 12-step programs such as Alcoholics Anonymous or Narcotics Anonymous that provided an alternative way of understanding their experiences of navigating recovery and a foundation for care and accountability that was used. In some cases, although this was less commonly mentioned, participants engaged in medication-assisted treatment or MAT, and that was used to help manage withdrawal along with co-occurring mental health conditions. Faith emerged in this conversation around resources as very complex. For some, recovery involved reconnecting with religious teachings and their spirituality in a way that emphasized mercy and accountability. And in these cases, faith often supported their healing journey. However, when addiction was framed primarily as a sort of spiritual deficiency, it often intensified shame and isolation and delayed help seeking for the participants. And this shame and isolation and this framing of substance use and addiction as a spiritual deficiency was talked about often as coming from within the Muslim community itself. And the most consistent gaps in resources that were discussed included a lack of awareness of available resources for themselves, for their family members, and for community members at large. Participants were also dissatisfied with short-term treatment models and their lack of cultural and religious congruence, and they had a really strong desire for culturally and religiously responsive care. Several participants expressed interest in mosque-based recovery groups or more visible support structures within Muslim community institutions for folks struggling with substance use and addiction, starting from things as basic as kindness and welcoming attitudes in the Muslim community and Muslim spaces to having established Alcoholic Anonymous or Narcotics Anonymous groups within the masjids themselves. So the issue was not necessarily the absence of treatment models broadly, but that there was a limited integration of cultural and religious identity into those treatment models, and there was a lack of cultural and religious responsiveness from the people providing those treatments. And then they also mentioned that there was a challenge with accessibility from a Muslim context. And so this brings us to the sort of broader role of the Muslim community itself. Across interviews, a negative community response to substance use and addiction was the single most consistent theme. All 14 participants addressed community as a hindrance to seeking care and to starting the journey of recovery. All participants described stigma as a significant barrier. There was a high level of fear of judgment or social exclusion or isolation if they were to disclose or if that information were to be known within the community that they were struggling with substance use or addiction. And often those feelings of fear and isolation and exclusion often led to prevention of or delayed care or prevention of disclosure to people who could help them. In many cases, families navigated addiction and substance use in private to avoid those negative social consequences, and that led to, again, a lack of access to care. Additionally, convert participants described additional scrutiny, with addiction sometimes being interpreted by community members as a lack of religiosity within their family rather than a health condition. Beyond interpersonal stigma, participants pointed to structural gaps, limited psychoeducation in mosque spaces, few visible recovery programs, and minimal formal training for religious leaders in substance use disorders and addiction. Importantly, participants were not simply critical of the gaps that they identified during their journeys, but they articulated a vision of what support could look like and what they hoped it would look like. And so they identified things like greater community literacy around addiction, collaboration between clinicians and religious leaders, and recovery spaces that were embedded within Muslim institutions. Many participants emphasized that addiction should be addressed as a collective concern, particularly in the Muslim community, given that it's both a religiously and culturally collectivist community. And along with the participants' recommendations, we share some additional opportunities for growth and improvement in support and care across different roles in the community. So at the community level, education is key. Education is foundational. Addiction must be understood holistically through a medical, psychological, social, and spiritual framework, rather than simply being understood as from a moral judgment lens. We recommend more community education opportunities and development of Islam-based recovery programs and faith-based social services that can help people navigate this experience. Community and religious leaders, imams, ustadas, sheikhs, sheikhas are uniquely positioned to normalize discussion around addiction, reduce stigma, and collaborate with clinicians to provide integrated, comprehensive, and holistic care. And they're able to support in sort of being a partner in the network of care for people navigating addiction. Community youth leaders and masjid youth coordinators can serve as key prevention and early intervention facilitators. As we mentioned, many of the participants were exposed to substances in their youth, and so individuals in these roles can really help in a prevention and early intervention role. For any intervention, service, or program to be effective, masajid boards, Muslim organization leadership need to allocate funds and resources to this work. And we must remember that community and religious leaders can't address every challenge alone. These individuals have incredible amounts of work on their plate. They're often expected to be counselors and educators and scholars and mediators and therapists and all wearing, 100 different hats simultaneously. And so community members must take the initiative to learn and educate themselves to combat the stigma that's present around this topic and to support initiatives of healing in whatever ways they can. And so for clinicians, both Muslim and non-Muslim, cultural and spiritual responsiveness is essential. Given the collectivist orientation of many Muslim communities, incorporating family systems into treatment planning and can improve engagement and adherence to treatment plans. And then finally, policymakers and at the policy level, funding structures must account for cultural, responsive, faith-aligned, and accessible models of care. And so for community members who are in policy work, this is an area that requires our attention and requires strong advocacy so that we can get the resources and supports that we need to develop out and build out the tools and institutions that can support individuals navigating this struggle. Quickly, just some of the limitations of the study. I mentioned earlier that there were some challenges in terms of participation and recruitment around stigma. If you've been involved in research with Muslims, you know how hard it can be to get our community to participate in general. And so that, in addition to looking at such a stigmatized topic as substance use, it made it even more difficult. And because of that, we weren't able to sort of comprehensively address the diverse intersectional identities that were present in our community and how those identities might influence the experience of substance use and addiction differently, which is why, sort of moving forward, we need more research. We need to expand the scope of the work that we're doing, and we need to increase interdisciplinary collaboration, community level education, and a comprehensive evaluation of existing services. And so with that, thank you so much for your time. I hope you all read the report, and I'll turn it back over to the ISPU.
Thank you so much, Dr. Amina, for that wonderful presentation and also for guiding us through some of these very important findings. Now that we sort of have a good sort of baseline understanding of what the report is telling us, I would love to introduce our panelists who will help us to further ground some of these findings. Their full bios will also be in the chat. So our first panelist is Dr. Rania Awad, who was also our primary investigator for the report. Dr. Rania is a clinical professor of psychiatry at the Stanford University School of Medicine, where she is the director of the Stanford Muslim Mental Health and Islamic Psychology Lab, as well as the Stanford University's affiliate chaplain and affiliate professor of Islamic Studies. In the community, she serves as the president and co-founder of Maristan, a holistic mental health nonprofit serving Muslim communities, and the director of the Rahma Foundation, a nonprofit organization dedicated to educating Muslim women and girls. We have Tabari Zahir, who is also an advisor on this report. He's the founding director of Lamps of Light Project, a Southern California nonprofit dedicated to treating mental and behavioral health issues with a special focus on addictions in Muslim communities. With nearly 2 decades of experience counseling, mentoring, and teaching the incarcerated, formerly incarcerated, and inner city populations. Zahir is a licensed clinical social worker and a certified drug and alcohol counselor in California. And lastly, we have Khalila Anke. Khalila is the executive secretary of the Malati Islami World Service Organization, which is a faith-based recovery fellowship that provides an Islamic framework on for healing from addiction. Her work is rooted in the lived experiences and a commitment to serving individuals and families affected by substance abuse through peer support, spiritual accountability, and compassion-centered recovery. Khalila is particularly committed to expanding access to culturally responsive recovery spaces for those who often struggle privately, including women. So I wanted to start by thanking you all so much for being here today and for the important work that you are all doing on the ground on these issues. As I go through these questions for the panelists, please feel free to submit any questions you have for them through our Q&A box, and we'll be going over those as well during the Q&A portion of this webinar. So I wanted to start with Dr. Rania. To Dr. Rania, as the principal investigator of this study, what stood out most to you in the lived experiences shared by the participants, and how did those stories reinform the report's reframing of addiction as a progressive disease rather than a moral or a religious failure?
Yes, and first, assalamu alaikum. Thank you so much for having us here, and thank you to ISPU for, first of all, even coming up with this particular topic and then choosing my lab to head this conversation and do this research project. We at the Muslim Mental Health and Islamic Psychology Lab are really honored to work on this particular topic, and a number of really great resources have emerged since we started working on this topic. We have a line of research in the lab specifically dedicated to the topic of substance use and behavioral addictions as well. And to your question, I'll start with Bismillah, and to say that absolutely what struck me the most in, reading the final report that came out is really, it's not just the severity of the hardships that were shared, but the most striking consistency that I saw was how the participants described their loss of agency. This wasn't just merely a series of bad choices, which I think many people think that's what's happening when we talk about addiction, but it's really a physiological hijacking that's happened for so many. So 3 points that I'd like to summarize from our findings. The first is this concept of choice. For many people, they believe somehow that substance abuse and use and addiction is actually a choice. But so many of the participants actually describe a turning point in their own narrative, in their own history, where it moved from, pleasure or relief seeking or whatever it is that drew them to substances in the first place to becoming a biological necessity. One of the participants, and I'll quote here, actually said, I wasn't just chasing a high anymore. I was trying to maintain a baseline of being, quote, human. And I thought that was really striking. It really I highlighted that. It really struck me, to feel that this was the only way to kind of feel human. Which then takes me to the second summarizing point that I'd like to give, which is this concept of moral resilience. So often people turn to, well, if they were just religious enough, if they were to just pray more, if they were to just will this away. And what we must explain is that addiction isn't a moral failing. And it's not something you can just with willpower kind of will away. This needs to be understood as an illness. And that you have participants in this study who, with vulnerability, shared that they were deeply spiritual individuals. There were also people who were in high-level professional positions, and also others who, in other ways were successful at life, if you will, and felt this intense shame of even sharing what was happening to them because they knew that their values were no longer aligned with their actions. So they talked about, and I'll quote another participant who called it a shame spiral, is the term that was used. And it's talking about how stigma created this shame spiral where treating addiction as a sin or a character flaw led them to isolate more. And the more they isolated, the more they used. And that spiral is very important for us to understand, especially those of us who are community leaders, our clinicians, are those on the front lines helping and assisting our communities to really understand that shame spiral. And lastly, and I mentioned this already, and it was mentioned by Dr. Amina. Thank you for a wonderful presentation. This concept of reframing addiction as an illness, understanding that this is a progressive disease, whether you want to compare it to diabetes or cardiovascular disease, we have to understand that there are specific triggers to this illness. The first, I would say, here is environment. This was brought up very often by our participants, external stressors that activate this. Secondly, genetic predisposition, understanding that some people have a genetic predisposition to this disease, just like any other disease. And thirdly, that when addiction will eventually get to a point where there's organ dysfunction and there are physical and physiological changes that happen to the brain. And this is not just something about having better morals or better religion. So I'll summarize here my last point here and say my most profound takeaway from this entire study was that once you understand addiction in this light, you then start moving away from the moral aspects of it to now understanding that this is a brain that is essentially offline. And you can't just sort of pray away or willpower away a neurochemical imbalance, just like you can't do that with a broken leg. And so I hope, inshallah, that helps us, understand this illness much better, and then helps us treat it as a community, as leaders, and as individuals who are, with sincerity and humility, hoping to do so for our communities, inshallah. Barakallahu fikum. Thank you.
Thank you so much, Dr. Rania, for that really insightful answer. And I really loved your analogy on praying away a broken leg. I think that really puts into context sort of the importance of language as well when it comes to sort of understanding these things and framing things as a disease. My next question is going to be for Tabari Zahir. So Tabari, the research shows that participants had mixed experiences with Muslim families, mosques, and sort of community spaces. Some encountered stigma and sort of more exclusion, while others found that there was genuine support in these spaces. Drawing from these findings and from your work at Lamps of Light specifically, where have you seen sort of the most positive examples of community and family support in recovery? And how does a sort of harm reduction, compassion-centered approach help shift these spaces towards more care, dignity, and healing?
شكرا سجيلة. Assalamu alaikum wa rahmatullah, everyone. Thank you for coming. Thank you for inviting me. Thank you for Stanford Muslim Mental Health Lab for doing this work. Thank you to ISPU for encouraging the work and guiding it. Bismillah. So to answer that first question, I want to lay some context. And I want the audience to know that I'm deeply involved in the community, here in Southern California, at different junctures. I give a khutbah at a different masjid every week for 52 weeks of the year. So, what I'm going to say is coming from actual on the ground experience, talking to the boards, talking to the imams, talking to the shuyukh, and also talking to the community, not just in a formal conversation, but many times it leads to therapeutic conversations about what they can do as individuals, what they can do as couples, and what they can do as a family. So at the communal level, what I see that is most beneficial for the communities is number one, that there are people in the community, especially those who are responsible, like the boards or the imams or the administrators, that they just understand the times. This is like number one. Do they understand the time that we're in? Do they understand that the potency of chemical addictions, is much higher in our time? Do they understand that the potency of internet-based addictions are much higher during our time? And this is purposely done. If they understand that this is the time that we're in, that we're going to see more people that have addictions, that we're going to see more people that struggle as families, as couples, as individuals, then they can respond correctly. Without that, they're out of the loop. They don't even understand what's happening. And then by that, they isolate, people who keep coming to them saying, I'm struggling with this, I'm struggling with this, my children are struggling with this, have more programs about that. They're like tone deaf. So that's the first thing that I'll say. The second thing that I'll say is that you'll always find those communities that are willing to work with vulnerable populations. And I really, really think that as a community, we have to, like open up, what do we mean by vulnerable? We have to open it up and we have to explain it. Because Rasulullah sallallahu alaihi wasallam himself, he said, "Ibghuni bidu'afaikum." Like seek out on my behalf, you're vulnerable. So we have an idea of, the du'afa, the weak. These are the orphans. These are the widows. These are the divorcees. These are, all of those people in the community, they need a lot of help, right? But I think we have to, for our time, we have to expand it. And we have to include the new Muslims. Because in Southern California, we have a very, very large population of new Muslims. And alhamdulillah, we have some organizations that are responding correctly. Because new Muslims come with filters. They come with their background. Some of them have addictions. Some of them have, people in their family that have addictions. Sometimes they're married to people that have addictions. But they're Muslim and they're our responsibility. They are also the vulnerable. With that, I think that we need to include the formerly incarcerated Muslims. They became Muslim in prison. And when they come home, they don't really find a support system. Some of them had addictions before they became Muslim. And then they come out to the same environment that facilitates that addiction. And like the Muslim community is sometimes the only line of defense that they have from falling back into that addiction. I also think that, people that have an addiction, whether chemical or behavioral, are part of that new du'afa, that vulnerable population. They have an addiction. And as mashallah, Dr. Rania just explained, sometimes the brain is just offline. This is, the nafs have become accustomed to something that has an excessive appetite for something, and people need help. Are we responding correctly? And so what I see in the community is those communities that understand the times and they understand who are the vulnerable in the community, they're able to respond correctly. Without that, there's this glossing over. There's people are not seeing and understanding, like what's happening. And then lastly, what I would say is that those imams, those shuyukh, those, asatid, the teachers and, administrators in the community, they have to learn how to delegate, right? The ones that know how to delegate, they say, okay, listen, I studied Sharia. I really don't know about mental health. Okay, so delegate that. Delegate that to someone who does. Don't pretend. Sometimes in our community, we're very good at pretending, but don't pretend that you know this. You don't know it because lives are actually at risk. So those are the three things that I would say, goes a very, very long way with helping, the community. Um, and to answer the second part of your question, um, about harm reduction, you did ask me about harm reduction, right?
Yes, correct.
Okay. So, and I'm gonna try to get off of this soapbox real quick. Um, First of all, like we have to understand that harm reduction has different understandings depending on the industry. So when it comes to public health, it's things like, providing needles, clean needles for people to use so that they don't transmit diseases, right? Um, and sometimes, as I can't remember, someone mentioned it about providing medicated help so that people can wean off, they can walk down an addiction to a substance. That's a type of harm reduction. What Muslims need to understand is that we have examples within our own tradition of different types of harm reduction, just starting with the Quranic revelation,
Mm-hmm.
right? The Quran did not forbid intoxicants all at once. This is a type of harm reduction. At first, there was like what we would call psychoeducation about it. Like it's part of Shaitan's handiwork. And then it was don't come to the prayer while you're intoxicated. And then finally, there was fashtanibu, like now just give it up, right? Just leave it alone. But it was a gradual process. And we also have, like for example, Aisha radiallahu anha, the wife of Rasul Akram sallallahu alaihi wasallam, she said very clearly, if Allah subhanahu wa ta'ala would have forbade alcohol like all at once, the Arabs would never have been able to do it. So this graduality, of helping people, off of a substance or off of a detrimental behavior is harm reduction. All right. And I can give you even, more practical examples than that. So, that are more religiously, oriented. So, for example, the man who came to Rasulullah sallallahu alaihi wasallam and he said, Ya Rasulullah, I want to become Muslim, right? But I don't want to pray 5 times a day. I can do 3. Rasulullah sallallahu alaihi wasallam accepted his Islam based on that commitment. This is understanding the human psyche, the human psychology, human behavior. Because as soon as he gets used to the 3, he'll add 4. Once he gets used to 4, he'll add 5. This is a type of harm reduction. Like remove the disbelief and then let him work on the actions. Imam Abu Hanifa, same thing. A man came to Imam Abu Hanifa and he said, Yeah, Imam, I want to, I don't want to pray. I want to pray. I just don't want to make wudu. I don't want to make wudu. We've all experienced this. It's like, man, I broke my wudu. I got to make another one. We know what that's like. Imam Abu Hanifa told him, okay, it's okay. Just pray. Just pray. So, of course, he's surrounded by other mujtahidun, that people of the highest level of learning. And they're looking at the Imam like, how can you tell somebody to do that? He said, listen, when he realizes that he will not get any reward for his prayer, he'll change. And that's exactly what happened. So I'm saying all of that to say that, we have to be wise about harm reduction. We have to understand the human condition. We have to realize, like start people off and help them to, overcome, whatever is ailing them. And the last thing that I'll say is this: families, sometimes they go to extremes. They they will either enable the family member in the addiction. They know that he's struggling or she's struggling with something, and they'll facilitate it by giving them the car, by giving them money, etc. Or they go to the other extreme, which is just kick him out the house. I don't want to have anything to do with you. Don't talk to me. You're not my son. Those are two extremes. The middle ground is to say, I see that you're struggling with something. Um, and I would love, to help you, but I cannot carry your baggage. All right. I cannot carry your load. I see that you're burdened with something. Me, I can't carry that, but I'm going to help you however I can if you want the help. And that help has to be, things like helping them to find a therapist that's qualified to deal with addictions, helping them to find support groups like Millati Islami. Our sister Kalila is here representing Millati Islami, which is a support group for people who are suffering from addiction. And Lamps of Light, we also have, a weekly support group, for people who suffer from trauma and addictions. And so I think that all of these things are like, types of, harm reduction that is specific to the Muslim community. We have to tie our harm reduction to our tradition, and there's plenty of examples there. And thank you for listening. And inshallah.
Inshallah. Assalamu alaikum.
Thank you so much, Vari, for that very enlightening perspective, also on sort of how harm reduction has existed in the Muslim, in Islam and in the Quran forever, and it's just about sort of utilizing those tools. My next question is going to be for Khalila. So, Khalila, the ISPU report highlights limited access to culturally responsive and spiritually grounded care for American Muslims that are struggling with substance abuse. Can you share how Malati Islami's mission and peer-led faith-centered model helps to fill those gaps, particularly for those who also struggle in private, including women, and what you've seen in terms of the model's effectiveness and also the potential for replication in other communities?
Assalamu alaikum, everyone. I'm Sister Kalila, and I want to thank all who spoke before me. So I'm gonna just tell you this. The brother already said something about the stigma. It is. It's a lot of masjids that won't let us have the Maladi Islami meeting in their masjid. That's number one. And number two is that uh when we were here earlier, sometimes people like to minimize things. And I like what the sister said. I remember when I was using, and I went to my doctor. She said it's a form of mental illness. So in Maladi Islami, we addressed all manifestations of the recovering Muslim, including behavior and addiction. Because after you get clean, right, it's some stuff that you need to work on within you. That's going to automatically happen. So it's like when I first started with Maladi Islami, I was sad because I said they should have that for the Muslims. Some do, some don't. So this is what I do. I strive for the cause, y'all. You know, and I'm real thankful for Allah. And we have women's meetings. We have meetings just for women. We have meetings just for men. Then you got the crowd, and then we got literature study. So we doing the right thing. But I'm starting to accept what I what I think is good for the community and addiction. Most people don't. That's why we have stigmas. People say stuff about people that get use drugs, lies, and I always say everything is up for revision because it's just like the brother said. They was drinking Kamar. And it gradually came to that. So at the end of that, the Prophet Sallallahu Alaihi Wasallam said, even if you have a drop, no, he said, don't even have a job because of the danger that it causes and how when you use chemicals and you are a Muslim, it messes, it may give you spiritual distress. So I'm all about the Muslims, and I really appreciate that you had invited me to come. And I just like I'm gonna do whatever I can because, just keeping it moving. Like I go to every September, I go to Harrisburg, and it's recovery day because I want them to know that Muslims need recovery too. And I'm gonna tell you something else. So somebody told me, right, if I do 2 rakats and ask Allah to forgive me, I'm not gonna drink no more. But I'm gonna say this. That didn't work. This is how the other sister said I had to go in for treatment, because I was kicking off alcohol too. And then what we have to teach the young kids, just because it's legal, baby, that doesn't mean you can do it. You don't want anything to cause harm because this is what type of world that we live into. The brother, what he said. Because see, sometimes I feel like they act like they like that, you know, and they don't have the resources. So anybody that calls me and we got a good Melody Islami page, we're gonna let them know. What's up. And it's so beautiful because when I came here 6 years ago, I didn't even know it was that. And in my bio it had that my son committed suicide. May Allah be pleased with him. I was in the other fellowship, but I was lost, y'all. When my son did that, I couldn't, like, even though I was clean, I still couldn't grasp burying my child. So when I went to Maladi Islami, who is religiously specific regarding spiritual principles, that helped me. When I found out that Allah will not burden me with more than I can bear, I trust Him because that's the only way that it's going to work for me. But we share our experience, strength, and hope. We do everything. We don't call each other addicts though, because we don't believe in that. Nicknames and stuff. But other things we have respect. And I'm getting ready to give a learning day. So if y'all give me the information, I can send you an invitation because those are important too. To teach the community about Muslims and recovery. And it is a stigma. I'm gonna say this again, but Allah said that we need help. He said whatever we do, whatever we share it, we share in this burden because we don't say nothing about karma. We don't say that. Then we say on the personality of a person, the qalb, the heart. It says if the heart is blind, then you in trouble because it's not the eyes that only go blind; it's the heart. So when I learned about that, that was good too, you know. And we are a religion of purifications, but I'm gonna just tell y'all, we never, people come to the meetings and stuff, and I go do me. We don't make them feel uncomfortable. I said to in closing, I said to one sister, Allah's mercy encompasses His wrath. That's what I told her. Don't stay stuck. And it's like the brother said about the families. Sometimes they can't help you because they don't know what to do. And people always saying, if this person got a new wife and a job, right? He wouldn't use. That's not true. It was what she said me about the trauma is within. So I just want to say once again, I appreciate being here telling you guys about the Milani Islamic program for the Muslims. And we take non-believers too, you know. We give, to everybody. Thank you.
Thank you so much, Hulila. I really loved what you said about just because something is legal doesn't mean that you should do it. I think things get normalized really easily these days, and it can become hard to draw lines when things are that normalized. I want to now move on to sort of our audience Q&A section. I do see a question here that I think might relate to what Khalila you were talking about in terms of Malati Islami not being allowed in certain masjids. So the question is about how we can hold AA in masjids and what like the requirements are. But I think that would apply to like the Malati Islami structure as well.
Well, the masjid, right? It's a place of worship. So we thought that we should put a Maladi Islami um there, but the imams they don't want to. They just don't want to, but that's okay. you know. But I was saying, this is what I was saying. Where else they gonna go? Because when you come to the masjid and you pray and you ask Allah for forgiveness, when you trying to get yourself together, because it's a neglect of our higher selves. So now we got to learn how to be healthy, right? Because it hurt me. It was 7 of them. It was me and my girlfriend. It was 7 of them, and only one said yeah. The rest of them said no. So we just do it, the best that we can, and a lot of people is very happy that being a Muslim, you know how Allah feels. You got other people like you, because I remember you said about the women to shame. Women, I'm a counselor. Women don't like to say anything, y'all. They will not say anything. They have to be coached. Then after they coach, you need a voice to say what's going on. Because we women, you know? So, you know, I hope I answered the question correctly.
Yeah, thank you so much, Hulila. I also see some questions here that are around the report. Maybe Dr. Rania or Amina could give some insight on these. They are about what question does the research team wish would have been asked now that this phase is completed, and also what is one solution you wish gets continued support or gets implemented in practical ways.
I could take the second one. And I think this is what we've been talking about since, which is that absolutely. I have to tell you, in these last couple of years, everywhere I've gone in terms of talking to various masajid communities in America and across the globe, actually, I ask a specific question over and over again. And I say, do you have any support for Muslims who are dealing with addiction of any sort, chemical, behavioral, otherwise? And almost always it is a resounding no from every single one of our masajid, community centers, hubs, organizations, etc. And it's really upsetting because the question that I'll ask as part of the discussion on mental health and stigma that comes up very often, the question that I often ask is, we as a community have gotten better about talking about mental health. We're starting to do this more often than before, which I'm very thankful. It wasn't like this when I was first, myself entering this field. So I'm very thankful for that. But have we actually provided support? So my next question to the entire, group of people that I'm speaking to, I'll often say, where do people go typically for support? I'm very honored Sister Kalila's here with Millati Islami. But if we were to say in general, where do most people go that require addiction support, especially in recovery? Almost everybody will answer and say AA. And they'll say, then I'll ask the question, where do you find most AA programs, groups? Where are they typically located? And almost everybody will answer and say, in churches. And so my next question is, so that means we're sending our Muslim community members that we are responsible for as a community to church. Is that what you're telling me? And so once we kind of come to that realization and that conversation, now we have to shift the conversation. Because I'll tell you, and I don't mean to put out my own Muslim community, which I love and adore very much, but I've asked them this question too. And the answer that I've received, unfortunately, is one, I'll hear things like, we don't have this issue in the community, which couldn't be further from the truth. And here this report is going to show that very clearly. Secondly, I'll hear, but we don't want, and forgive me, I'm being very kind of raw and very just forgive me, for this, but the answer I'll hear is we don't want those people in the masjid. And my answer to that is, who exactly are those people? And that's, this is a conversation that really needs to have at a grassroots level, on a spiritual level, and also on a community organizing and effort level. And I hope, inshallah, some of this, even though, forgive again the rawness here and the emotion that comes with this, but it's upsetting because we are putting so much effort in our communities in different corners of it. And I also want to applaud those communities that are doing so, because I know someone's going to write and say, but our community is, may Allah bless you and your community, mashallah, but you're the rarity. So I'd like us to move this needle a little bit further today and say, can we look back at our own communities and actually say, where are the support systems that need to be in place? Who are we losing as a process? And who are we sending to church as a process in the process? as opposed to helping them within our own communities, inshallah. So that would be my, forgive the little spiel there, but it's said with a lot of heart and emotion here.
No, thank you so much, Dr. Rania. I saw another question come in that was very related to what you were just talking about around sending people to churches. It is, do you find that Muslims struggling with addiction feel comfortable coming to like a masjid or AA, or is there too much stigma or worry about the community potentially finding out about their addiction? So, from the point of view of those who attend the AA meeting for help, would they prefer to go to the masjid where they would be seen by the community as opposed to uh, a church, I guess, as you had said?
I'll start the answer, but I hope Brother Tabari will also speak to this as well. I'll tell you, it's been an interesting thing. When I first started this work in general, I was actually told, oh, don't bring the topic of addiction into our Muslim masjid or spaces because we've attempted to do so. And this is like now I'm dating myself, but this is over a decade ago. And we tried to do an addiction talk, and there was one person who showed up, and they grabbed somebody else from the hallway to make them too. And I believe that that's a real story. I don't think that was an exaggeration. But I have to say, Maristan, the organization that I helped co-found, and along with some of course, our wonderful partners out there, we had an event specifically on Muslims and addiction in the masjid, and it was packed. This is only a couple of years ago, and it was packed, as in to say we couldn't even find room for everyone to sit. And one of the questions that came up was exactly this question, Sajila, which is that if we were to have resources right here at the masjid, would and the people who are attending are those who are people in recovery, people whose loved ones are dealing with addiction, and people who themselves have lived experience with addiction. And, the answer was, if there are resources right here in the masjid, I would come, I would sign up, I would be there. And that just seemed to be what we kept hearing over and over again. And often it wasn't that we wouldn't come because of the stigma, it was because there were no resources available to come to in the first place. And so that's the best to my knowledge. But Brother Tabari, please take this away. And what would you say to this question?
Shukran, Dr. Rania. I agree with you totally that the tide is changing. That last month or maybe 2 months ago, in 1 month, I got invited to come and speak very openly about pornography, right? And you have to understand that most addictions follow a very similar pattern. So it doesn't really matter if you're talking about some type of sex addiction, you're talking about a chemical addiction, or even other internet-based addictions. The stigma is there for all of it, right? And I think that the tide is changing in that there's more people requesting help. There's more people going to the masjids asking for help, because I'm starting to get some of the most conservative masajids and even learning institutions to say, come and speak about this openly, where exactly like Dr. Rania said, 10 years ago, probably would have never happened. So the demand is there. And the demand is there. Now the Muslim community has another responsibility, which is to respond, in a way that is ihsanic, right? It's from the perspective of ihsan. So it's not just going and giving lectures, but it's having studies like this done to support the interventions that we as clinicians, the clinicians that are here, you know, um, deepen your knowledge about this so that you can, you know, people want to hear what you have to say, that, people are moved when you speak about it. Sometimes it's not just about the information, it's about the presentation of the information. So the greater community, the administrators of the community, they have a responsibility. Those of us with specialized knowledge, we also have a responsibility, that like we're giving the resources, we're telling people where to go, we're answering the questions, we're making ourselves available, we're making the information available, so that's what I would say. But alhamdulillah, there's change is happening.
Thank you so much, Tabari. I see another question here that I think I'll just sort of direct to all of you, whoever wants to take it on. If addiction is a neurobiological illness rather than a moral failure, how can Muslim communities reconcile religious discourse with medical understanding while reducing shame but still preserving the role of faith in recovery?
Assalamu alaikum, Sister Kalila. Um, Sometimes if you do get it, you will get it, and I understand, especially when they was talking about the church and all of that and everything. But again, sister, some people are just so stigmatized. They are. They are so stigmatized. And then it's like the other brother said, like y'all be talking, but where's the proof? And I noticed with America that people put a blind eye to addiction until it gets bad. You know what I'm saying? So we need to just strive for the cause, keep on doing it so they can have an outlet. Because I remember when I became a Muslima, I couldn't say Allah's name in the other fellowship. And I was or Alhamdulillah and all that. I was and then I came here. So we do this. We have resources, we have a website, anything you need, We get ready to have a convention in September, Maladi Islami in Minnesota, where the need is great with the Muslims and addiction, you know. So that's what we try to do. We just try to carry the message. Thank you.
Thank you. Thank you, Khalila. Anybody else? Dr. Rania?
Yeah, happy to share a little bit about the question with neurochemistry, neurobiology, and kind of from a spiritual perspective. And I'll just say very simply, when we speak about mental illness, physical illnesses, any illness for that matter, what's important to remember here from a faith perspective, from a religious, spiritual perspective, is that the Islamic understanding is that Allah subhanahu wa ta'ala, God sends, with every illness, he sends treatments. And so there isn't really a contradiction in this in any way, actually. A concept of the prophets, the prophetic saying, لِكُلِّ دَاءٍ دَوَاء, for every illness, there is a treatment. Instead, the onus is actually, it removes the stigma because essentially it's saying if there is any form of illness in society, and the Islamic belief is Allah sends treatments and cures, but they don't just fall out of the sky. It requires ingenuity, people to do research and work to actually come to the treatments that are viable for those conditions. So as Muslims, we have a fard kifaya, we have a communal obligation to actually find what those treatments are, which is why our noble predecessors historically never shied away from any condition, including mental illness, which is what I'm frequently lecturing about and talking to communities about. And so they created entire healing institutions, Maristans, to kind of treat mental illnesses. They created institutions and programs in order to treat addiction. This is not new. It's been as old as humans are. So that's to say it's always been around in societies and communities. It's only in recent times that the level of stigma and also parallel to it, the lack of Islamic understanding that's kind of plummeted, unfortunately, has led us to a point where we have such high levels of stigma and such low levels of resources. This wasn't the case in historical Muslim communities, but that's a different lecture and conversation for a different day and time. But I hope that kind of allows us to really think through this from a more global perspective, inshallah.
Thank you, Dr. Rania. I see a question here around how professionals can address addiction and recovery among youth specifically, given that a large proportion of them utilize substances as coping mechanisms or to address external and internal traumas coupled with peer pressure and popular culture.
I'll answer this question, and then I just want to go back to that to the original the question before. As far as the youth are concerned, there's a few things that I think that we have to do. Number one, you just got to be with them. You got to be with them. You got to hang out with the youth. Mashallah, they'll keep you young. They're going to tell you all the new slang, and they're going to keep you abreast of all the stuff that's happening, if they feel like they can trust you, if they feel like you're not going to blame them, you're not going to criticize them, you're not going to make fun of them, things like that, they'll open up their whole world to you. I bear witness to that, first and foremost. Um, the second thing that I think that we can do is, um, there are credible messengers to the youth. Okay. And one group of credible messengers that I think are underutilized is the formerly incarcerated. Why am I saying that? Because all of our youth are impacted by popular culture. They watch basketball, they love football, they hear hip hop music, they want all the cool phrases. That's all popular culture. And there's nobody who understands and have been impacted by popular culture more than the formerly incarcerated population. And it just so happens that by the grace of Allah subhanahu wa ta'ala, a large majority of them are becoming Muslim. So if we would let them into these spaces and allow them to be mentors, allow them, and of course, there has to be some type of vetting process. They should be involved in the community. They should have overcome their vices and things like that. But you take them and you allow them to be credible messengers to the youth. You allow them to be, uh, um, you know, um, they can tell you their story as an intervention. Like, I went down this way, don't go down this way. That's what I mean by a credible messenger. And they have the whole life story to explain it. I think those two things, spending time with them, establishing mentors and credible messengers, our community, we have the resources, we have the ability to do it. I think that's the lowest hanging fruit. I believe that. Um, I want to go back to to the original question, about, like the dichotomy between what's happening with a person physiologically as opposed to what's happening with a person, spiritually. And, what I would like to say is, like, as clinicians, one of the things that we are trained to do is to look at the person holistically. We look at the person biologically, we look at them psychologically, we look at them as social beings, we also look at them as spiritual beings. So, if you just, you know, focus on one aspect of the person and you say, oh, he's suffering from this, let's just, for example, this spiritual disease, and you don't take into consideration the social aspects that led it there, you're missing it. You're missing the picture. All right. Or if you look at what's happening physiologically and you don't take into ex- how it's affecting him spiritually, you're missing it. You have to look at the person holistically. Now, even during the time of Rasulullah sallallahu alaihi wasallam, there was a tendency to do this, and I'll give you an example. Abu Huraira radiallahu an, he tells us that once, just from hunger, he was so hungry. He was one of the Ahlul Sufa. He used to live on the porch where many of the poor companions of the Messenger of Allah sallallahu alaihi wasallam lived. And one day he just passed out a couple of times from hunger. And one of the other Sahaba, according to the Arab tradition, this is what they used to do. If they thought someone was Majnoon, they would come and place their foot on the back of their neck, while they would turn them over, put their foot on the back of their neck to help. It's like an exorcism, right? To get the jinn out. So someone did this to Abu Huraira radiallahu anhu while he was in that state, from hunger. And they are mistaking it for a spiritual condition. So when he comes to, he says, I am not Majnun. I'm just hungry, right? And we have a tendency to do this sometimes. We have a tendency to over rely on, oh, this person they're lacking iman. This person has a jinn attached to them. They need ruqya. They need, all of these spiritual things. And we haven't dealt with biology. We haven't dealt with the psychology or the social environment of the person. It's malpractice to jump immediately to spirituality without taking into consideration the first three. Okay. So that's what I would like to say to all of the imams here, all of the clinicians, all of the chaplains, like, You have to look at the person holistically. And then there should be a process of elimination so that you can find, as Dr. Rania, mashallah, very eloquently explained, you can find the cure. Okay? And please excuse my uh going on.
No, it's wonderful. Very informative. I see another question here on how addiction often gets worse because family members tend to deny that it's happening, which enables it to get worse. So the question is sort of around how can this kind of work be done for families to accept and to be educated in the community? Nobody seems seems interested in tackling that one.
No. I mean, I was waiting for my co-panelist, inshallah. But I'll say that this is definitely something that we recognize at Lamps of Light, and we just decided to do something about it. We gathered, information, and we just started a support group just for families. If you're a family member that has a support that has a family member, a loved one who is suffering from any type of addiction, all right, any type of addiction, you can come to this support group. It's weekly, every Wednesday. You can find more information about it either on our social media or our website. And people come, they come, they have a loved one. It might be a spouse, it might be a family member, a child, a parent, and they want information on, like, how do I support without enabling? Usually that's the question. How do I support my loved one without becoming part of the problem? And and then, I mean, I think, we have to do the same thing, at the communal level. We have to become informed about what's happening. We have to become informed about, like, what are the interventions? How can we do early intervention? And if it gets really, really bad, then how can we treat? So that's what I wanted to say.
Thank you so much. Anyone else want to tackle this one? All right. Another question I would ask you all is sort of on a more positive note, what gives you hope when you think about the future of recovery support in Muslim communities? So what's working?
I can jump in here and, just start, inshallah, because I think each of our panelists can do something really beautiful and explain very beautifully the work that they're doing. I think Lamps of Light and Military Islami are excellent role model examples of this kind of work. Earlier in the chat box, I actually highlighted another program as well, called, it's a book, actually, a book, written by a couple of the Taiba Foundation students. These are individuals who, Muslims who are incarcerated and have lived experience actually directly with substance use. And I think their adaptation of AA and NA, kind of this concept of the 12 steps, was beautiful. At the lab, we had the honor of actually of reviewing this work before it was published and making sure all of the scientific and research-based aspects of it were accurate. Alhamdulillah, was the Islamic part of it is on point, alhamdulillah. And it's called Overcoming Addictions: An Islamic Approach to Recovery. And it's actually being used inside for those who are incarcerated, meaning those who are in prison at the moment. And I hope, this is what gives me hope, to actually see it on the outside as well in free society, and also just across our masajid and communities. I'd love to see an Islamically integrated approach to the concept of dealing with any form of addiction, whether it be chemical, behavioral, otherwise. And it gives me hope that these resources have actually been developed, they've been vetted, they've been trialed and piloted, and that they work. And I just hope, inshallah, we are all able to move that needle and allow this to proliferate further in all corners of our communities, inshallah ta'ala.
Assalamu alaikum. I would like to add to that. One of the Maladi Islami meetings is on Saturday from 3 to 5. and we used the Overcoming Addiction book along with the Melody Islami book, and you is absolutely right because they be like this for the Muslim. I love that, just to see because sometimes people don't understand. They just even if they have good intentions, but when we do what we have to do for Allah, He always shows us and blesses us, and I pray for them too that they get it.
MashaAllah. What gives me hope is the response from the Muslim community. Um, I'm seeing two things. I'm seeing that number one, if it's delivered properly, you know, like using, our tradition, then people respond correctly. And I'm bearing witness to that. Whereas our as when it comes to addictions, even though our community is suffering from addictions, and I'm talking about the whole gamut, whether it's chemical or behavioral, our community is suffering. Um, I don't think there's enough people who are beating the drum in front of the masses of our community to explain what's happening, why it's happening, and what we need to do to change it. But I do see that when people do, like mashallah, Dr. Rania and the Taiba Foundation, they were like pioneers years before Lamps of Light was started. And those videos that they put out in the books and everything, people are responding, mashallah. Um, and that's what gives me hope because it's like when the information is available, when the solutions are available, usually our community responds. But I also believe that us as clinicians, chaplains, imams, shuyukh, the asatid, the ustad and ustadas, um, we also have a role to play. When we give the presentation, when we're talking about it, we have to also use ihsan. We have to know that we're competing with social media. When you get in front of an audience, you have to deliver knowing that you've got 5 minutes to make your case and to kind of draw them in because we're dealing with, social media. And just consider that, that people have less attention spans, they have, less time to like engage. And so we have to respond to that too. And when we do, I'm noticing that the community responds, and that gives me hope, mashallah.
think I'm the last person to share. But I think as uh, in my primary role as a researcher, I think the thing that gives me hope is seeing the um, the growth in the field, examining the different elements and aspects of this topic. Um, I'm way more junior than everybody else on this panel, inshallah, but in the few years that I've been in this space, I've seen incredible growth in the research and the rigor of that research. Um, and I think that grounding our community organizations, the resources that we provide, and the tools and things that we develop in that research is only going to make them stronger and more effective. So I think that is the thing that really, really is hopeful for me. And seeing all of the researchers who are even junior to me at the particularly at the Stanford lab, working on all of this and contributing to um, expanding this field and expanding our understanding um, is really incredible to watch. So
Thank you so much. I know there's a couple more questions in the Q&A box, but unfortunately we are at time. I wanted to just take a moment to thank all of the panelists for taking the time to be here and for speaking with us all today. Some very insightful discussion and a lot of great tools for the community to take away from this conversation. And of course, thank you all for all the amazing work that you're all doing. And thank you everyone for joining us. We've launched a short poll. Please take a moment to take it before you hop offline. We will be sharing a recording of this webinar along with a list of various other resources, including all the ones that you've shared and ones that we've compiled in a follow-up email. So please do keep an eye out for that and share those resources in your communities, in your networks. And I also encourage you all to read the report if you haven't done so already and stay in contact. Thank you all and have a great rest of your day.
Thank you.